Okay, welcome to this ISBNPA webinar. This is chaired by the Special Interest Group on Socioeconomic Inequalities. Attendees are joining us as we go along, so we'll proceed with the webinar from now on. I'm Matthew Hobbs, I'm the chair today, and today we have two presenters, Christina and Justin, who I'm going to introduce shortly. They're both experts in their own right in terms of their working with different population groups, and we'll be discussing today working with hard to reach groups. Now, we've in terms of the attendees, we've got a wide range of different attendees from different backgrounds, and obviously there are a wide range of different hard to reach groups, but we'll do our best for you to take away some kind of key messages that you might be able to apply in your own research. So I suppose firstly, thanks to all for tuning in. This is a slightly different format to what we usually have, in that it relies much on your discussion as it does on the presenters. So usually it's 2 to 3 presentations, and then we have a short period for questions at the end. In this presentation today, we've got 2 shorter presentations at the start, and then quite a bit of time at the end for a discussion based kind of webinar where you can ask questions, contribute in terms of your experiences with hard to reach populations, maybe offer some solutions to what's being presented by Justin and Christina, and maybe share some lessons that you've learned as well. And then hopefully we'll have a bit of a discussion at the end. So it will very much depend on the questions that you ask. So do start thinking, if you've got any questions, there are 2 features on the webinar. So one is the question and answer tab at the bottom. So if you click the Q&A, you can ask a question and answer in there. Or if you prefer, there is the chat feature. So you can ask a question in the chat in terms of the panelists. And if you click on that, again, you can ask a question there. I will keep an eye on that. But it is really important, because it's a discussion-based webinar, that we do have some questions. So please do contribute for questions to ask our panel. So to give you a quick overview, the purpose of the special interest group for ISBNPA members is that basically we have a shared interest in a given topic. So for us, it's hard to reach groups in terms of socioeconomic status, so low socioeconomic status to high. And while it's chaired by this group, hopefully there'll be some wider practical tips for you to take to hard to reach populations more generally. And if you're interested in this webinar, there are more online from the other ISBNPA groups as well. So just before I introduce Christina and Justin, I just want to highlight a few key housekeeping points. So the first is that hopefully this is a shared kind of safe space where we can share and feel comfortable with sharing our challenges as practitioners, policymakers, researchers, the people that we have in the room. And while it's unlikely that we won't give you a definitive answer or some advice, it is potentially that you're working with a hard to reach group that isn't covered within our expertise. But I don't think that's an issue. There will be people that can contribute within the group, and hopefully we can have a discussion and a bit of advice at the end. So our speakers today, the first will be Justin. Justin is a research associate at the MRC Epidemiology Unit. He's interested in the development and testing of community and family-based interventions that aim to promote youth physical activity. Primarily, he's working on at the minute developing and testing a feasibility and effectiveness, looking at the feasibility of the Families Reporting Every Step to Health, or FRESH intervention, which I'm sure you'll hear more about later. And he's previously worked with increasing girls' physical activity and reducing inactivity in organised sport. Following on from that, we've then got Christina, who is a public health nutrition scientist at the MRC Life Course Epidemiology Unit. And her real interest is looking at advancing and understanding the pathways between psychological, social and environmental determinants of poor diet. And then from that, looking at identifying focal points for interventions, and then looking at how we can reduce the kind of global burden of ill health associated with that poor nutrition and diet. Interestingly, I was reading on the profile, she's previously worked, in a range of settings, one including remote indigenous communities, and also in non-government within state and regional government departments. While potentially this is not a hard to reach population, I'm sure there's some lessons that can be learned from this, because she's just recently established a collaboration with a UK discount supermarket chain, and is leading an independent evaluation of the nationwide cluster trial, which is looking, I think, correct me if I'm wrong, Christina, later, but the placement of different products. So without further ado, that's enough from me. I'll just be chairing the session, so do have a look at the question and answer and the Zoom chat. We've had one email prior in terms of some of the questions that you might be asking, but do, as they're introducing themselves, Justin and Christina, have a think about some of the questions that you might be asking. One final bit of housekeeping is that this session is being recorded, so it will be available for you to watch when you get back, and obviously there are the various functions for you to participate in. So I'm going to hand over to Justin, and he will introduce himself, Antonio, in terms of his research and his background. So thanks for tuning in, and I hope you pick up something useful.
All right. Can you see that, Matt?
Yeah.
All right, cool. So thanks for the intro and the opportunity to speak at this webinar. So I'm going to jump straight into my slides. I'm just going to describe a little bit about the work that I do, and then I'll explain what I'll be discussing for the rest of the presentation. So as Matt mentioned, I'm a research associate in the MRC Epidemiology Unit and the Center for Diet and Activity Research at the University of Cambridge. So I'm working in the Behavioral Epidemiology Group led by Esther Venslaus. And in the Behavioral Epi Group, at least part of the program aims to develop and evaluate interventions to promote physical activity in young people. So it won't be a surprise that almost all of my work is primarily aimed at observing or intervening to increase child physical activity. And as Matt mentioned, it's mostly been in trying to increase girls' physical activity in a variety of community-based settings that occur outside of school time. So these images kind of show some of the settings that I've worked in. So more recently, the work that I'm doing now in Cambridge is a family-based physical activity intervention called FRESH, so families reporting every step to health. So FRESH is primarily a goal-setting and self-monitoring intervention. It's delivered online, and it aims to increase physical activity using whole families living in rural Norfolk and Suffolk, which is in the east of England. So we've completed a feasibility study. We're about 2/3 through a pilot trial now. And I realize these populations probably weren't the first that came to mind when you saw the title of this webinar, but they're incredibly challenging to recruit, particularly the families. So for the rest of my presentation, I'm going to talk about some of the recruitment strategies that we've used in FRESH, and then just some of the practical tips for community and family-based research. So a bit more about where we've sampled from. So about half of English kids are meeting physical activity guidelines, so getting 60 minutes of moderate to vigorous physical activity a day. If you look in that magnifying glass, that is where Norfolk and Suffolk are. That is where we are recruiting in FRESH. So slightly lower than the national average. And then looking at some of the work from the SPEEDY trial, which was conducted in Norfolk, we've found that as children transition into adolescence, their MVPA declines, they're less active outside of school time, and young people in rural areas are less active than their urban counterparts. And I guess I should point out as well that about about half of the population in Norfolk and Suffolk is considered to be living in rural areas. And in these counties, you're also seeing some socioeconomic disparities in terms of income and qualifications compared to the national average. I'm not going to speak much about the intervention, but I'm going to give you a little bit of background on FRESH and again, focus specifically on recruitment. So the eligibility criteria for FRESH is shown on the slide here. We only required at least one index child. So this is a 7 to 11-year-old child. So this is years 3 to 6 in the UK. And one parent to be involved in FRESH, but we did encourage whole family participation. So these are some of the recruitment strategies that we've employed. So community-based recruitment included things like swimming clubs, GP surgeries, community centers, brownies, guides, cubs, things like that. And there were pros and cons to each of these strategies. So for instance, the school-based recruitment, some of the pros were like, lists of schools are pretty readily available online. So finding schools to approach was quite easy. It was also the most targeted strategy that we used, since we only distributed recruitment materials to kids in years 3 to 6. So we knew all the kids that were receiving our recruitment material were eligible in terms of age anyways. But the cons were like this, the strategy was, really time and resource intensive because it took multiple emails, multiple phone calls to get approval to disseminate this material. We went to schools to deliver an assembly to get kids excited about FRESH. And we also stayed back at some of the schools until the end of the day to speak to parents and answer any questions. And I guess I should also point out that Norfolk and Suffolk are about an hour, hour and a half away from Cambridge. We traveled, up to 2 hours from Cambridge. So a massive time effort using that strategy. Whereas, social media is quite the opposite. You can throw up a couple tweets quite easily, but it's way less targeted. So it's definitely some pros and cons with all of these recruitment strategies. So these are some of the figures that we had from our pilot recruitment study, pilot study, sorry. So for us, perhaps the effort that we went through to recruit at schools was worth it because it turned out to be the best strategy out of the ones that we employed. So yeah, we got just over half of our families through schools. So I'm just going to point out that in total we recruited 41 families. So even though we had this wide range of recruitment strategies, we still didn't recruit as many people as we were hoping. We were hoping to get 60 families. So yeah, I mean, the message is like recruitment and recruiting families is really tough. So I'm just going to give you some of the, I have top 10 tips. There's no real rank. I just happen to have 10 tips that we've either, learned through experience or we've found in the literature. So one of them is to use a multifaceted approach in terms of settings and being visible in the community. So trying to go places where potential participants will be, and trying to get your recruitment material displayed in multiple locations so that the more exposed participants are to your recruitment material, the better you are in being able to possibly recruit them. Along the same lines, we found it beneficial to target both children and adults. Make use of any network, ins, connections that you might have to make your life a little bit easier. And if you don't have any, I suggest trying to partner with some trusted organizations in the community or trusted people in the community, and doing that quite early on in your recruitment period, because that does make a big difference. if possible, or if it's applicable, emphasize that you're using a tailored approach to changing behavior. So you're scaling things compared based on individual physical activity, for instance. Another strategy is to just highlight other benefits participants might receive from participating in your study. So one of the things that we did was we highlighted that we highlighted the fact that families could spend more time together as opposed to just talking about being more active. And making your recruitment material really easy to consume is a great tip. One of the things that we did was we created a recruitment video, and you can watch the recruitment video on the EPI Unit's YouTube channel. The other thing that did was it took the burden off kids in having to try to explain what FRESH was to their parents. It was easier for them to say, "Mom, can you watch this video?" than explaining what FRESH is and then trying to get them to sign up. So that was one of the things that we found with the video. Consider whether incentives are appropriate. That's definitely one way to recruit. With this one, say for instance, a parent wants to be involved in the intervention but doesn't want to be part of the evaluation. You might want to consider allowing this because it might help with engagement, intervention fidelity, and then retention. So having participation in the intervention and the evaluation separate might be beneficial in recruiting as well. The other thing is just be patient and prepared. So for a lot of these, especially like schools or something, you have to make multiple calls and send multiple emails, just to get a hold of potential participants or schools. So you need to be prepared because, you might only get one shot at getting them on board for your study. So get your spiel ready, I guess. And again, this recruitment is hard. So it's probably going to go a little bit longer than you anticipate. So you'll need to really be persistent and be ready to grind. It's not exactly the most glamorous part about research. It takes a little bit of creativity and a lot of hard work. So yeah, just be ready to grind, but also, don't forget to celebrate the small victories along the way. So some of the tips I presented came from these studies, so definitely check them out for more information about recruiting and engaging with families. A couple of studies done by Helen Brown, who was with us in the behavioral epi group, and a study here by Phil Morgan and colleagues. And that's pretty much it. I have a few questions I'd like to pose to the audience, and just any other recruitment strategies that other people are using, we'd welcome. And I also was curious to know if people have any suggestions on how to estimate reach when you're unsure of your denominator. So for instance, we kind of fortuitously were able to get a spot on BBC Look East, and they promoted FRESH. So trying to estimate reach when you don't really know how many people it reaches is hard. And similarly with like employers, like an employer might have like 5,000 employees, but you're not sure how many people fit your eligibility criteria. So I was just wondering if people, or what people are doing in terms of estimating reach when they're not sure what their denominator is. That's it. Thanks.
Awesome. Thank you very much for sharing that, Justin. Yeah, some really good. I think that's a really interesting question that you posed at the end there. A few questions have come through, but I think we should just save them, and then we can answer them at the end together with Christina, I think.
Yeah, sure. Yeah.
Just to emphasize as well from Justin's presentation, there is if you want to speak within this webinar, if you want to, rather than writing a question or using the chat feature, you can also raise your hand, and then hopefully, fingers crossed, I I should be able to unmute you, and then you can ask the question and talk within the webinar. So there is that option as well. But yeah, thanks, Justin, for that. That's really interesting. Definitely challenges working with rural populations and families. I've got a few questions for you as well that I can ask us at the end. The original, so just before I introduce Christina, as I've said before, the ISBNPA, the International Society for Behaviour, Nutrition and Physical Activity, who's hosting this webinar, the idea came from the conference. So the idea for this particular session came from the conference last year, where we had a special session on within our shared interest group, and there was a real need to share the if you like, shared challenges, shared solutions, and questions within regards of practical tips for working with hard to reach populations. So that's where this idea came from. So there have been a few questions through, but if you would like to share those, that would be most useful. So now I'm going to introduce Christina. So Christina, as I said, has established a couple of different collaborations, and she's got a background in a range of settings. She's going to now introduce her work, and then what we'll do is pan over for any questions, and then if we don't have any questions, which I don't think is going to happen, but we'll come to that at the end. So I will just unmute Christina. Antonio, if you could share. There we go. Perfect.
Okay, thank you very much for that, Matt. As Matt said, I have a long-standing interest in really trying to understand what it is how to really find strategies to improve the food choices of those with the poorest diets, and really that involves engaging with hard-to-reach population groups. So I'm going to be talking tonight about a few projects that we've been undertaking in Southampton, and describe some of the strategies that we've used to engage with those populations and a few of the challenges that we've had along the way. To start, I really just wanted to introduce our team. I'm part of a team at the Life Course Epidemiology Unit at Southampton, and really this is just to acknowledge that all of the studies that I'm going to be talking about have not been purely instigated by me, and many of my colleagues that you can see here on the screen have, or they've all been engaged with various components of these studies. And really the key driver of the work that we do in Southampton is to try to understand and improve the diets of women before and during pregnancy in order to improve not only their own health, but also the short and long-term health of their children. So next, I just wanted to describe Southampton as a setting. So for those of you that aren't aware, Southampton is in the south coast of England, and it's a relatively deprived city. So although it's well known for its being a major cruise liner port, and it is actually a relatively deprived city. And it features in the top 100 most deprived local authorities out of about 350 in England. So really for the affluent south of England, it's quite a deprived group, but it's surrounded by some very affluent areas. So it makes it a really interesting location to be studying dietary inequalities. And many of the residents of Southampton have participated in studies that we conduct. Yes, I just wanted to highlight that we all are aware of that dietary inequalities are a major public health concern. And really this slide here just highlights that dietary inequalities start early. These data come from the Southampton Women's Survey, which was a preconception cohort study of over 3,000 mother-child pairs. And what it really shows here is on the y-axis, you've got infant diet, you've got better diet at the top and less healthy diet at the bottom. And on the x-axis, you've got mother's diet, you've got healthy diet to the right and less healthy diet to the left. And really what you can see is a very clear correlation. So we're really interested at trying to break these inequalities early. And therefore, many of our research studies have involved women, as I mentioned. And one of the studies that we have been involved in is called the Southampton Initiative for Health. And really what this slide highlights is that it was a long process of engagement to really engage with setting that these women frequent. So the Southampton Initiative for Health the aim was to improve the dietary behaviours of women of childbearing years, so aged 18 to 45 years. And we targeted Sure Start Children's Centres because local data suggested that 70% of local families visited these centres frequently for playgroups, for parenting courses, and for all sorts of other services like housing services and employment services and health services. So it was a really great setting to engage. However, this is really using some of those strategies that Justin suggested, where we had to engage through existing contacts or build those contacts to be able to engage the women. And you can see here from that timeline, from the first contact through to data collection point for our intervention study, took quite a period of time. You can see it's a good sort of 6 to 7 years there of relationship building. And the first contact happened in 2004. And really then it took a couple of years for us to be able to identify that there was some agenda matching. And I think that's another really important component of identifying and engaging with hard to reach groups, is identifying how you can match agendas. So we spent a lot of time with local policymakers who were also interested in improving the diets of young families. And actually, through that, we co-developed the intervention, and I guess that brings in a level of respect. And really that respect filtered through not only to design of the intervention, but also to the data collection techniques and methods that we used, which involved us going into children's centres and being with mothers when they were there playing with their children, as you can see that image on the slide. And actually, by really engaging with women when they were there in the centres, proved to be a very effective method. And actually the recruitment of women identified for this particular study was just over 1,000 women, and 37% of them were considered to be women that had lower levels of educational attainment. So they left school aged 16 years or earlier. And only 26% of our participants actually had degrees. So we really were quite successful in engaging in a hard to reach population. I won't go into any detail about the intervention, but you can see the references there at the bottom. And the next slide really just highlights 2 publications. So the top publication there really does demonstrate how long this relationship building took and gives some really nice examples of the factors that are needed to take the time to build the trust and to build the respect to allow that successful relationship to be developed. The second publication is conducted by a colleague of mine, Dr. Safir, and it really highlights actually that these problems occur throughout recruitment to trials. And this one particularly was around recruitment of pregnant women to a clinical trial. And really what it identified again is that women at this particular time of their life when they're pregnant feel quite vulnerable and a little bit reluctant to sometimes engage in research. And again, there's much to be had about building trust in researchers. This particular study, they were asked to take a form of vitamin D, so a supplement, and so there was some health concerns there as well, particularly among women who from more deprived backgrounds. And really it's about, I guess, engaging. Some of the key tips from this paper are about engaging with women, using communication and building their self-efficacy and their confidence in the research team. So moving on to another study that Matt had described that we've recently been engaging is about building relationship with a discount supermarket chain. This study is called WRAPT. It's Women's Responses to Adjusted Product Placement and Its Effects on Diet. And really this came out of some observational work that we did that identified that poorer in-store supermarket environments may be contributing towards dietary inequalities. So we made a targeted approach, and quite in contrast to the previous many years of relationship building, we were actually able to build a relationship very quickly with this discount supermarket chain. And you can see it's taken just over a year from sending a cold call letter to the CEO to actually recruiting participants. And I guess the aim of this study was to assess whether creating a healthier layout in discount supermarkets improve the diets of women customers. And the reason we were interested in discount supermarkets was because they've been shown to have poorer environments in their supermarkets, but they also are frequently used by disadvantaged families. So we really weren't sure, but we sent a cold call letter. So this goes against the tradition of trying to use a contact that you already know. But it did involve quite a bit of persistence. So we'd like to say that there was some serendipity, that the managing director was reasonably engaged in health and was interested in the research that we'd been conducting and was interested in engaging in a research project. But it certainly didn't come without a bit of persistence. And again, similar to what Justin had said, we had to do 9 hours of driving one day just to go and meet the managing director in person and really make that pitch. Again, so it takes time to build relationships. It involved us building trust and engaging with multiple members of the supermarket team, engaging with management, the data team, the communications team, building relationships with store staff, and really allowing us to, again, build that sort of mutual agenda and respect and trust each other and what we could deliver. I guess one of the key components of successful recruitment with this study was the ability to use the supermarket's loyalty card scheme. And that really allowed us to build on the trust that those customers already had with that supermarket. I guess we were also aware of the time considerations for them, and we conducted telephone surveys at times and places that were convenient for them. And also we did pay these women, so they were offered vouchers, and this was largely a consideration because it was in a commercial setting, and it was felt that this was very important. Actually proved to be a very successful component of allowing us to really reach hard to reach groups. And just to say, it was very successful. Nearly 60%, so 59% of women that we recruited into this study left school at 16 years or earlier, and 46%, only 46% were in paid employment. So we really were able to engage a hard to reach population. Moving on to another area, and this is work has really been led by my colleagues, Professor Mary Barker and Dr. Safir Stromer, and it's about engaging adolescents in health behaviours, particularly around diet and physical activity. And there's two studies here. I'll talk mainly about the study on the right first, which really involved engaging with teenagers who were pregnant. And that's really a typically hard to reach group who were often already engaged with services, but somewhat reluctantly engaged with services. And it was felt that sometimes in these settings that a research team can actually can actually limit the authenticity that you can extract from women. And so they engaged a social enterprise group, which is called Active Mob. And these people aren't researchers, but they're very skilled at engaging with women, and they'd sit on buses and engage teenagers. They'd travel to McDonald's and hang out and engage pregnant teenagers. And in that way, they were really able to learn a lot of real considerations that happen for teenagers, which may not have been elicited had the research team been conducting those engagements. And similarly, the study on the left is called Each Be, and it's about engaging adolescents in changing their behaviour. And this, again, really they've used some very creative methods to be able to engage adolescents. And part of this intervention study involves the development of an app, as you can see at the top there. And really they're trying to explore how adolescents are using this app and how it can be improved. And they've conducted one-on-one think aloud interviews, but actually feel that often teenagers feel like they're telling them what they should be saying rather than the authenticity. So what they've tried recently is sending them with iPads. And actually these iPads are audio recording. So they're recording the conversation that these adolescents are having together and allowing them to be in their own natural environment without the presence of a researcher, but a researcher is there for them to engage should they need to or have any problems. And again, they've really found that they've found some much more authentic data from adolescents around this. So it's been a very successful way of engaging adolescents, but also eliciting some quite true information. So I guess to summarise, the practical tips are about using key contacts to facilitate the building of relationships and access into hard to reach groups, having patience and persistence, and just being aware of the time that it can take to sometimes build these relationships. Acknowledging the trust and respect and understanding that's required when we are engaging with hard to reach populations who have their own needs and requirements. And also not to be afraid to be creative. I would almost say that sending a cold call letter to the CEO was one creative method, just as using audio recording with iPads is another creative method. And I guess then we'd love to hear what has worked for you. And finally, just to acknowledge our funders and the broader teams that we work with, and of course, all the participants. I look forward to a discussion.
Awesome. Thanks a lot. Thanks to both, because these things wouldn't happen without you sharing that information. So thanks, Christina, and thanks, Justin, for sharing that. We do have some questions. So we've got probably 10 to 15 minutes. I will do my best to get through most of them. So the first one was from an email that we received overnight, and it relates to incentives. So you've both got, I'll just unmute Justin, so you should be able to hear. So in terms of incentives, do you think that for lower socioeconomic status individuals, what appeals to this population in particular? Would it be small incentives? Would it be big incentives like price, potentially after the completion of a trial, or would it be, I think, smaller things as we go along?
We haven't done much in terms of including incentives. I haven't really done much at all with incentives. But I suppose, you know, you could do like a draw or something. You have one big prize or something, and people are entering a draw. It's just an idea. Yeah.
Christina, did you say you'd?
Yeah, we have used incentives. So we used incentives in the supermarket setting, and really that proved to be incredibly important. We tried different values, and depending on, so we speak to women 4 times and do 4 telephone interviews with them, and actually found that a £30 was the right amount. So they were happy to receive it 3 out of 4, sort of a £10 voucher 3 out of 4 times. So use some incentives with adolescents, and that has been a range of incentives. Sometimes it's a draw, sometimes it's a voucher, again to really show that you value the time that they're giving, and those things have shown to be quite effective. Also, sometimes if it is an intervention, then that in itself can often be an incentive, an adequate incentive. So the app that sort of we're developing as part of HB is shown to be a very good incentive, and hence control group is having a delayed treatment.
Okay, thanks for that. There are some compliments about the graphics that have been used in the slides as well, and the quality of the presentation. So well done to the 2 presentations. There's one question about what are the guys clubs. I think this is Justin, potentially some of your kind of multifaceted approaches, and maybe a bit more of an outline on what the guys clubs were and how maybe you feel that they worked. Maybe a bit more detail on that in terms of the different approaches and different settings that you had.
I'm not sure what guys clubs are. I definitely, I don't know if I misspoke or something, but I might
the scouts.
I might have said cubs. That might. I saw that comment. I'm wondering. I might have said cubs. I'm not sure. I don't know what guys clubs are either.
Okay, cool. I think it was maybe the different settings that you used, and the cubs and scouts potentially. Yeah. But we can move on to the other one. So given that obtaining a truly representative sample among low resource and at-risk populations is unlikely, to what extent does the target population change or get redefined as a function of the success or struggles of recruitment? So
I think that's a really valid question. And I think it's something that you continue to grapple with. Certainly in the Southampton Initiative for Health study, we did a baseline and then a follow-up. And actually we did find that we lost women to follow-up, and actually it was a reasonable proportion. And as a result of that, we actually conducted another cross-sectional survey as a way to boost the numbers of women from more deprived backgrounds. So that's not necessarily great because you're not following women up and it's a cross-sectional sample, so there's sampling issues there. But it was one strategy that we have used in order to try to boost the sampling and try to improve the representativeness of the populations that you're exposing your studies to.
Yeah. Thanks for that. Within the, I really like the stuff on the authenticity of the data that you got from the apps. Is that, I was interested in terms of I've seen a couple of presentations on, as a scientist, trying to be creative and using new methods. And I wondered, was that a typical kind of method for you using the app? Do you think it had worked for all the different contexts potentially and geographical regions, or would it work better in, for example, your teen populations?
Yeah, I think it works particularly well in a teen population. That's certainly what we found. And what is really evident is the comparison between one-on-one think aloud interviews or peer interviews, where actually they're in a setting where they're with an adult and they're feeling like the context and the topic is around health. And so therefore they're more inclined to tell the researchers the things that they think they should be saying. We're enabling particularly teenagers to be in their own social environment and to be around their peers without others influencing that is very, very important. So I think that's been an incredibly helpful new strategy that has been used. And it's been facilitated by prompts, environmental prompts that would spark teenagers to talk and think about the topics that the researchers may have raised themselves had they been present. So some of those different strategies. In terms of whether they work with other population groups, we haven't tested them as yet. And it'd be great to hear from anyone else who may have tested those kinds of strategies, more creative techniques.
Yeah, we haven't had any responses, but if anyone has who's kind of tuning into the webinar, if you have any sort of solutions in terms of more creative strategies that you might have used, do feel free to share it, because that is the aim of the session, and we are interested to hear what you've done as well. But yeah, thanks for that. It was quite impressive to hear the kind of methods that you'd been using. Justin, there's one question for you in terms of, and Christina, I think you both said networks use networks, I think. What particular networks have you used, and can you without disclosing, obviously, any confidential information, but how did you use those networks? Can you give a bit more detail on what you might have done with those networking opportunities?
Yeah, sure. A couple of the ones that we used. It was a bit of a struggle to get into schools, and we ended up having a contact in Suffolk County Council, and he put us in touch with a few PE coordinators. And as soon as we got in touch with the PE coordinators, that really helped us, get to the principals, the head teachers a lot faster. So that helped. Another network that we tapped into was Active Norfolk. They actually helped pay for some of the intervention, and so did Suffolk County Council, actually, some of the intervention costs, and they did a few tweets for us, so it was kind of like a trusted organization that people in the area knew. They sent around a newsletter. They invited us to a couple of the events that they were doing. So we got to speak to employers and we got to tap into their resources in terms of social media.
Nice. Okay. Is there anything from?
Sorry. Yes, we similarly used personal contacts as well. So there may be colleagues who worked with colleagues who led scout groups, or also made approaches to people in the city council, just as Justin had mentioned. And actually, with the supermarket study, we really found that the cold letter was successful to some extent, but actually making that personal approach and making that personal contact and doing whatever you could to build those personal relationships and getting people to know you and to trust you really as people is incredibly beneficial. And it really does go a long way, and it makes then distant communications sort of via email or telephone much easier.
Mm-hmm. Yeah. And do you feel that's why the relationship with the CEO potentially went quicker compared to the previous trial, or was that?
Yeah, so I think that was a little bit serendipity. Like I said, I think that there were a lot of things that were shifting in the world of health, and pressure being placed on research on supermarkets from government, from industry, from the public. So I think there were a range of different things. But again, that's part of relationship building. So capitalising on some of those external events that allow you to then build those relationships is really, really important. And it really is about mutual agenda creating, and sometimes that's always evident, but when it is evident and when external events allow you to capitalise on those, you absolutely have to grab them. Yeah.
Okay, thanks for sharing that. That's really useful. We haven't got any more questions as yet, so I'm going to give people 2 more minutes. If they do have any burning questions, it would be really useful to hear from you through the question and answer, which some people have asked the question, or through the chat. But I suppose one of my interests, because I've not recruited from families before, were who were the key stakeholders, Justin, in terms of recruiting from families in a rural area? I know you've mentioned networks and using that, but who were the key stakeholders maybe within the families when you were making that initial contact and maintaining that over time?
A lot of it was driven by the kids. I mean, they were the key drivers for wanting to participate for a lot of the families. Surprisingly, this was kind of surprising to us. So we found that almost no dads initiated contact with us to sign up to Fresh. It was probably like 95% moms, but we found during the focus groups that the dads became just as engaged in the intervention as the kids. So I think that is definitely an advantage to recruiting your whole family. Like a dad might say, you know what, can you sort out all the details to get us included? But then once they got through the admin stuff of signing up, the dads were quite engaged with Fresh. So we found that, they found that they became quite key stakeholders as well.
Nice. So that's really interesting, because I've not worked with families before, so that was one of the burning questions. So interesting. We have got another question here in terms of, do you have any experience with using translators, such as community group workers that translate from the researchers to the target group? Maybe this is an extra step in terms of the relationship building, time investment. And how do you think, or how much do you gain compared to directly approaching the target group? So kind of, I think, an intermediary between you as the researcher and the target group that you're trying to recruit. And it may, I'm not sure if you do or don't.
Yeah, I don't have any experience with using translators. Sorry.
Yeah, I don't have any direct experience either. I will be doing some work in India in the new year, where we will be using translators to do some developmental work for a intervention. But at the moment, I don't really know. I do think that the important thing is to back translate, particularly if you're instigating or directing the research, and you're using translators to then conduct interviews or focus groups, or to work with the participants. It's pretty important to ensure that it's back translated appropriately, so you really do have an understanding of what's being said.
Yeah, I agree. That's an interesting idea in terms of the time and the effort it might take in order to get to some of those populations there as well.
Yeah.
Okay. We don't seem to have any more questions, so I think in terms of I'll just double check just in case anyone's raised their hand. No, so we don't have any more questions, but if there are, okay, we do. They're coming through slowly but surely, and I think that's one of the things of doing the discussion-based webinar, that things might come to people as we go on. So one of the last questions we've got time for is, do you think the category hard to reach might be complex? So when we're essentially talking about groups that are socially marginalized and feel like nobody is interested in them, so we need to acknowledge more openly the structural issues that make them hard to reach. That's a really good question.
Yeah.
In terms of who they are, perhaps why they're socially marginalized, in terms of the structural issues. And I think this, I'm not sure where this kind of questions come from in terms of geography or the type of population, but I think this will vary potentially by the structures that are around them. But I don't know if you've had any kind of experience or any thoughts on that. For either of you.
Yeah, I guess it's a real acknowledgement that our agenda is around health, and for often for hard to reach populations, they are just grappling with actually surviving, getting a roof overhead and getting food into the children and doing day-to-day living. That I think that's what you might be meaning by some of the structural issues. And I guess it is real recognition that actually health is our agenda, and it's about working with where the communities are at. And I guess that's where participatory research and co-creation of interventions can be so effective and powerful, where we don't presume that we know what the solutions are, and that we work with communities in being able to identify and develop the correct kind of interventions that are appropriate.
Yeah, I think that's a great point. It'd be interesting to know if you did ask that question, what your hard to reach group were, because I know there's some issues in terms of like labeling a group hard to reach, in terms of their kind of labeling a group. There is a question in terms of, and again, if other people, this is a chat function, so this is really useful because we're a group of researchers in the same room at the same time, so we may as well use our combined expertise. So if you do have any answers to any of these questions, please do share it in the chat function, because we can discuss that as well. There is one other question, which is, do you have any advice other than building relationships about potentially how we might engage groups with totally different values and lifestyles to the researchers? So I think that's about potentially engaging different cultural groups, groups with different values, other than just kind of building the relationships that we've talked about so far.
I guess it comes down to really understanding the values and the lifestyles, and appreciating and again taking people for where they're at, rather than presuming that we know what's best. It's tricky because relationship building, sometimes when there's such strong cultural differences, it's very hard for us to potentially do that, and so we need to facilitate that and be engaged with leaders of the communities. Yeah, I don't know if you've got anything else.
Yeah, no, I don't know either. I think, don't have anything else to add to that, to be honest.
Yeah, I think engaging with the leaders of the community is a really important. The key, that's with reference to Justin's study, in terms of the stakeholders, who those key stakeholders are, the leaders in the community of that group. maybe, you know, a really important thing to get that kind of top-down buy-in. And maybe from, you know, if we think about the CEO of that company, we've got buy-in from a key stakeholder there, but again, probably with shared values potentially. Okay. So I do have a few more questions, but I'm not going to extend it if there's no need to. So we'll just tie up there. But I just want to thank again, because it's not always easy to talk about, you know, there are various different hard to reach groups. There are various different contexts and geographical locations that might, you know, make someone hard to reach, for example. And, you know, I think that's quite important. So I've just realized that there's one more question that we haven't answered, and this could be quite controversial. And I think will depend on your personal experience. But it's, in your experience, has the institutional affiliation, so being from a local university, helped or hindered the ability to reach participants? So I think that's quite a difficult question, and I think again will vary. But yeah, in your experience, has your institutional affiliation, so this is, I think, your experience personally, helped or hindered the ability to reach participants?
We actually had a participant in a focus group mention that. So basically, we were going into Norfolk and Suffolk. So Cambridge is not the local university. And they did question whether or not coming into a different county to run an intervention, and whether or not, basically, I think they were suggesting that Cambridge coming into a different county may have hindered recruitment for us. But it only came up in that one focus group. So I don't know if it did or not, but we did make our logo smaller on some of the materials.
Okay, interesting nonetheless, though, going into a different context, which is interesting. So in that case, it hindered your, potentially, we don't know for sure, but potentially hindered your ability to reach participants. Okay, Christina, have you got any?
Yeah, so I would think that with the Sure Start Children's Centres, it certainly facilitated that relationship with the centre managers and the policymakers within the primary care trust at the time. They very much were very favourable to having researchers involved to properly evaluate some activities within the centres. So that definitely helped. In terms of the work with our supermarket chain, I don't believe that the customers really mind too much about the university name. They mind much more about the loyalty that they have with their supermarket chain. And so actually, I think we're a little bit of an aside there, and the focus is much more on working through an existing relationship.
Yeah, interesting. Well, I think that's answered all our questions, and we're unfortunately out of time. So we're going to have to wrap that up there. But it's been really interesting in terms of, and again, thanks for sharing your experiences on what is a difficult topic. We've got a few things coming in saying great presentations, and you know, thanks for sharing that. So hopefully it's been useful, and hopefully it's been you've got a few points that you can take away from it as an attendee. And there are some, you know, there's an option to watch it back online as well, to look at those kind of top tips from Christina and Justin in terms of things that you might implement in order to increase the reach, increase engagement, and recruitment of hard to reach populations. And there were some readings on there as well, I think, that you shared, which might be useful for the attendees, and maybe even myself to have a good read of, I think.
Yeah.
Okay.
Cool. Thanks, Matt.
Yeah, thank you, Matt.
No worries. Thanks a lot for your time.
Bye-bye.